am going to explain insulin. Insulin is the first hormone to be isolated, purified, crystallized and synthesized. And insulin is a hormone created by your pancreas that controls the amount of glucose in your bloodstream. And it also helps the stored glucose in your liver, fat and muscles. And finally, it regulates your body metabolism of carbohydrates, fats and protein. And insulin important role in storing the excess energy. In case of excess carbohydrate, it causes them to be stored as glycogen, and mainly it present in liver and muscles. And carbohydrates that cannot be stored as glycogen, and glycogen converted under the stimulus of insulin into fats, and it is stored in the adipose tissues. And in the case of proteins, insulin has direct effect in promoting the amino acids uptake by the cells and converted it into amino acid into proteins, and it inhibits the breakdown of the proteins that are already in the cells. And different types of insulin are rapid acting insulin like Humalog and Novolog. This type of insulin are available in the market. Short acting insulin like regular, intermediate insulin like Lanti and NFH, and long acting insulin is ultra Lanti. Rapid acting insulin. Rapid acting insulin, its action start very rapid 5 to 15 minutes, and rapid acting insulin effect last for 3 to 5 hours, and it should be taken directly before the meal, and no need to maintain any period between the injection administration and the taking of food. And rapid acting insulin like insulin lispro like Humalog and aspart. Aspart is NovoRapid. This is the two pictures also. And short acting insulin, its action start after 30 minutes. This is the 30 minutes, okay. And its effects last for 5 to 8 hours. This is okay. Short acting insulin effect last for 5 to 8 hours, okay. Then the insulin, the clear insulin, Humulin or act rapid. And type of intermediate acting insulin known as the cloudy insulin. It is known as cloudy insulin or NPH, and this onset is 1 to 1.5 hours, peak 4 to 12 hours, and duration 24 hours. This is the onset 1 to 1.5 hours and peak 4 to 12 hours and duration 24 hours, okay. And Insultart, it is an intermediate acting insulin suspension containing isophene insulin or NPH insulin. This onset within 1.5 hours. Okay, this is the 1.5 hours. And maximum effect 4 to 12 hours. Okay, and duration is 24 hours. And next one is monotart. Monotart is the intermediate acting insulin. It containing the lenti-insulin. It is also known as lenti-insulin. In this cloudy insulin preparation, zinc ions are added to retard absorption and therefore prolonging the duration of action. And lenti-insulin onset of duration is 2 to 2.25 hours. This is, and maximum effect is 7 to 15 hours. Okay, and duration up to 24 hours. Then types of intermediate acting insulin. This is done. Okay. Can be found also as mixed type, which is insulin contains 30% insulin, clear insulin, and 70% of the cloudy insulin. It is usually used for patients who need 1/3 of their dose from the clear insulin and 2/3 of it from the cloudy insulin from the total daily dose. Okay, and it acts about half an hour after intake and its effect lasts for up to 24 hours. And insulin 30/70 or mixed tart 30 hm. Delivery methods is insulin syringe and insulin pen. There are the two methods, insulin syringe and insulin pen. And other methods are insulin pump, jet injector. When to give the insulin? Insulin give before the meal and for blood glucose level significantly above target range and for increase the ketones. Then what is ketone? Ketone is the chemically known as ketone bodies, and it breakdown of fatty acids and breakdown of the fat for fuel and the creation of ketones in a normal process for every person. And in a person without diabetes, insulin, glycogen and other hormones prevent the ketone levels in the blood from getting too high. Okay, and what is the dose? For many patients, insulin dose varies depending upon the blood glucose reading or blood glucose level and food availability or preference and physical activity level according to age and body weight. Syringe and vial preparation. Get supplies, insulin, syringes, alcohol wipe, disposable gloves and sharp container. Syringe and vial preparation. First of all, wash the hand, then apply gloves or wear a gloves, and then clean the insulin vial. And patient select injection site, which site to inject the syringe injection, and clean the injection site and check the insulin dose and remove the cap from the syringe and pull the plunger down to number of units to be administered in this picture. This is this one. And then inject air into bottle and draw out prescribed number of units of insulin. This one, prescribed number of units of insulin. Okay, and pinch up the skin and push the needle into skin at 90 degree and release, pinch and push the plunger in and count to 5 and remove the needle and dispose of syringes. Insulin pen devices, pre-filled pens and reusable pens. Techniques for dose preparation and insulin delivery are similar for both types of pen devices. Insulin pen preparation. It varies the insulin types like pen devices, pen needles, alcohol wipes, sharps containers, and then wash the hand and choose injection site and clean the injection site and screw on pen needle. Then what is the dose? Prime dial 2 units and remove air by pressing the plunger and repeat the prime if no insulin shows, and then number of units to be administered. Then pinch up the skin and push the needle into the skin at 90 degree and release the pinch skin and push down on the plunger and count 5 and then last remove and dispose the pen needle. Then insulin pump therapy. It based on what body does naturally. It means small amounts of insulin all the time and extra doses to cover each meal or snacks, and rapid or short acting insulin, precision micro drop insulin delivery and flexibility. And what is the insulin pump? Insulin pump is the battery operated device about the size of a pager and reservoir filled with the insulin. Then computer chip with user controller of insulin delivery and in 24 hours per day and delivers one type of insulin. This is a sample of pumps in insulin. After giving the insulin, check the site for leakage and correction dose is, it depends upon the retest, meal or snack doses, timeliness and supervision of food amount. Then how to store insulin? Insulin store the unopened insulin vial in the fridge without freezing it, and the used vials can be stored outside the fridge in good condition room for 1 month or 2 months in the fridge, and then protect the insulin from exposure to heat or direct sunlight, and don't leave it in the car, especially in summertime, because it is decomposed. And don't use the vials if you see any color changes or crystals formation or if it was frozen. Then check the expiry date is the very most important on the vial before using it, and don't use the expired insulin even though the vials was not opened, and keep out of reach of children. Then roll the vial gently between your hand and don't shake it before use. Thank you for watching this video. I hope you understand, but still you have any problem, you can comment. So we will continue rest of our topic in next video. Till then, like and subscribe.